ayes.
31 ayes and no nays. Rules suspended. Chair lays out 2018 on third reading. Secretary read the caption.
Record vote. The clerk will ring the bell.
Secretary, read the caption.
Committee substitute House Bill 49. 30 ayes, 1 nay.
There being 30 ayes, 1 nay, House Bill 3163 is finally passed.
Bills are passing at a feverish pace in the Texas House of Representatives and the Texas Senate this week, with just a few days left in the 86th legislative session. Thanks for watching TMA's Legislative News Hotline for Friday, May 24th. Up this week, a very quick summary of priority bills passed or still alive, but first, budget highlights and lowlights are emerging. As you know, the only thing lawmakers must do each legislative session is pass a budget to keep the state running for 2 years.
Senator Nichols?
This week, the Budget Conference Committee revealed their almost final proposal for the 2020-2021 state budget. This is video of the House-Senate conferees when they first met weeks ago. They've been working privately to try to strike a compromise between the Senate and House versions of the spending plan. Now that the committee's work is complete, lawmakers will take up the $248 billion budget on Saturday. The bill must be finalized by midnight Sunday, May 26th. As the next day, Memorial Day, is sine die, the last day of the session. Here's where we are. Doctors will see some of the proposed spending as good news and some quite disappointing. First, in Medicaid funding, some bad news. Despite TMA's call for a $500 million investment in Medicaid physician payment rate increases in the 2-year budget, the plan includes $0 for physician rate increases. Several weeks ago, TMA immediate past President Dr. Doug Curran described the dire need for that increase.
Physician services have not had any change in payment for 20 years. I mean, that's just, it's so wrong. It's wrong for the patients, it's wrong for the physicians. And it just makes it impossible for the doctor to be able to continue to see these people that really need our help and our care.
The budget does increase inpatient rates for rural hospitals. However, budget writers earmarked $350 million in state funds, $900 million in state federal all funds, for Medicaid cost containment. That means the state will have to find $350 million somewhere in Medicaid savings. Maternal health was another big TMA priority. The budget calls for an additional $52 million for women's health program spending. The biggest chunk of that, an extra $45 million, is for the Healthy Texas Women program, but $15 million of that hinges on passage of Senate Bill 750 for prenatal and postpartum coverage. That bill awaits final Senate approval. Behavioral health investment has a contingency as well. Lawmakers call for a $50 million increase to improve adult community mental health services and $8 million more for children's mental health. They also allotted $100 million for the new Texas Mental Health Care Consortium created in Senate Bill 10, which also would fund a new child psychiatric access network and the Texas Child Health Access through Telemedicine program. However, Senate Bill 10 was killed in the House this week on a procedural move and had to be tacked on to another bill, Senate Bill 11. The House passed that bill, but now the Senate must approve the change. So, those mental health improvements are not a done deal. Public health spending also has some good news. TMA suggested funding improvements including modernizing the state's public health laboratory, and lawmakers did just that, funding overdue repairs, adding money to replace old equipment, and retain skilled laboratory staff to do the work. The budget also funds a Department of State Health Services study of economic costs of responding to vaccine-preventable disease outbreaks. TMA urged this as well. Medicine mostly likes the budget for graduate medical education and physician workforce spending. The budget invests $157.2 million to preserve that all-important ratio of 1.1 first-year graduate medical education slots for every Texas medical school graduate. It also spends more to expand the psychiatry workforce. Unfortunately, the Physician Education Loan Repayment Program, which lawmakers cut last session, was not restored back to its higher level. Again, the budget must be finalized by midnight Sunday, which is just before session ends on Monday. The budget is the big bill each session. But how are the other TMA priority bills doing? Here's a brief lightning round update. We mentioned drama and mental health, behavioral health legislation a minute ago, so let's pick up there. Senate Bill 10, the Texas Mental Health Consortium bill, was killed on point of order this week. But House members later amended most of it onto Senate Bill 11, which is still moving. The Senate must now concur with the House's changes to SB 11 for it to pass. And House Bill 10, which would have created the Texas Mental and Behavioral Health Research Institute, died this week awaiting Senate debate. In maternal and child health, Senate Bill 749, establishing care level designations for hospitals that provide maternal and neonatal care, is in the Senate to approve House amendments. If they do that, the bill will be finally passed. Same fate for Senate Bill 750, which would improve maternal access to postpartum care through the Healthy Texas Women program. This is the bill we mentioned a minute ago, tied to the $15 million budgeted for Healthy Texas Women. No bill, no money. Senate Bill 436 received final passage and is on the governor's desk. The bill relates to improving maternal and newborn health for women with an opioid abuse disorder and their drug-dependent newborns. Of course, Governor Greg Abbott basically has three options for any bill he receives: sign it into law, allow it to become law, or veto it. Finally, House Bill 25 would establish Medicaid medical transportation services and allow children to accompany their pregnant mothers on doctor's visits. That bill is headed to a conference committee to negotiate differences between the final House version and the Senate amendments. The TMB Sunset Bill, House Bill 1504, awaits conference committee debate after the House didn't accept Senate amendments. But House Bill 1532, which would protect employed physicians' clinical autonomy and independent medical judgment from hospital administrators' interference, finally passed this week and heads to the governor. In telemedicine-related bills, House Bill 3345, which would let physicians choose the best telemedicine platform for their patients, finally passed the Senate on Wednesday and heads to the governor. And Senate Bill 670, requiring Medicaid to cover telemedicine services, also is on its way to the governor for his signature. Speaking of Medicaid, SB 1105 would streamline and improve Medicaid managed care for patients and physicians and cut red tape. The Senate must agree to House amendments added to it this week, or it heads to a conference committee before it can receive final passage. A similar fate awaits Senate Bill 1207. The Senate must agree to House changes or a conference committee must strike a compromise. That bill requires better explanation for Medicaid prior authorization denials. Turning now to public health, the Senate unanimously gave final passage to House Bill 1848 to establish infection control programs in long-term care facilities. The bill now heads to the governor. Also going to the governor's desk is House Bill 448, requiring rear-facing child seats for most children younger than age 2. Also en route to the governor is the CPRIT bill, House Bill 39. And voters will decide on additional CPRIT funding in a November election, thanks to House Joint Resolution 12, which passed weeks ago. Taking its time to get over to the governor is Senate Bill 21, increasing the age to buy tobacco and vape products to age 21, which the Senate finally passed earlier this week. And House Bill 2050, requiring written consent to administer psychoactive drugs to long-term care facility residents, awaits House consideration of Senate amendments. On the subject of opioids and prescription monitoring, the Senate gave final passage and sent to the governor House Bill 3284 to require electronic prescribing of opioids unless a waiver is granted and delay the mandate to check the prescription drug monitoring program before prescribing controlled substances. Not quite as close to the finish line as House Bill 2174. That bill would limit the duration of opioid prescriptions, require e-prescribing and opioid-related CME, and specify that prior authorization is prohibited for medication-assisted treatment for opioid abuse disorders. The House must approve Senate amendments or it goes to a conference committee. Two bills in the graduate medical education and physician workforce arena to update. Wednesday, the House gave final approval to House Bill 1065 to develop residency training tracks for physicians in rural or underserved settings. That bill heads to the governor. House Bill 2261 would boost the Physician Education Loan Repayment Program assistance amounts by $5,000 per year. That bill awaits House consideration of Senate amendments. Several health insurance bills are moving too. Last week, TMA Council and Legislature Chair-elect Dr. Debra Patt testified in support of House Bill 3911, requiring the Texas Department of Insurance to examine the network adequacy of preferred provider organizations and exclusive provider organizations at least once every 3 years.
We need to maintain adequate networks to allow patients to get care with relative ease. And House Bill 3911 would hold PPOs accountable for network adequacy, similar to how the Texas Department of Insurance holds HMOs accountable for that today.
The Senate finally passed that bill, House Bill 3911, this week and sent it to the governor. He also received House Bill 170 to require health plans to cover diagnostic mammograms at 100%, the same as screening mammograms. Senate Bill 1264, the balanced billing bill removing patients from bill disputes and requiring baseball-style arbitration for most surprise medical bills, awaits final Senate approval to go to the governor. House Bill 1941, which would prohibit freestanding emergency facilities from charging what the bill calls unconscionable rates, heads back to the House to vet an amendment the Senate added. If they do, it receives final passage. House Bill 2536 would improve prescription drug cost transparency. The House must approve a Senate amendment to give it final passage. Additionally, there are last-minute efforts to keep measures alive that relieve the prior authorization burdens for patients and physicians. As I said at the outset, it has been a blur of activity this week. But that's all for now. Please like and share this video with your TMA member friends. Thanks for watching, and please join us again next time for a final summary of the 86th legislative session on TMA's Legislative News Hotline.